Well, good morning, everybody, and welcome. Thanks for joining us today for our webinar, Navigating and Utilizing the New LUGPA Medicare Physician Fee Schedule Calculator Portal. I'm Celeste Kirchner, LUGPA's CEO. As leaders in a urology practice, you know that changes to the Medicare Physician Fee Schedule can have a tremendous impact on your group, and not just on individual physician reimbursement, but on the way your entire practice plans for the year ahead. Today, we're going to take some of the complexity out of that process. We'll walk through the use of the new calculator portal that simulates the proposed Medicare Physician Fee Schedule changes, and most importantly, look at what they could mean specifically for your group. Rather than focusing only on the national headlines or a single conversion factor, we'll really look at how changes in payment rates, relative values, and other policies flow through to the procedures and services that your clinicians provide every day. The tool that we're demonstrating today is designed to help bring all of that information together. Instead of asking your practice leadership or financial team to interpret a lengthy proposed rule and figure out what it means for your specific group, this tool helps translate those policy changes into practice-level views. You'll be able to see what services would be most affected, understand potential financial implications, and identify the areas that might deserve a closer look as you plan for the coming year. Throughout the session today, you'll have a chance to put in your questions in our chat feature in the webinar, and we'll get to those either throughout the webinar or at the end. And as always, your LUGPA political affairs and health policy teams continue to work for our groups to advocate for fair payment for essential urology services and procedures. And we encourage you and your groups to be advocates for the profession in Washington and in your state houses. With that, let's take a look at the tool and see how it can help your urology practice move from the understanding the proposed changes to planning for their potential impact. I'm pleased to introduce Cass Shadig, Principal of Willow Run Analytics, and we commissioned her company to help develop this highly personalized tool for our LUGPA groups. Cass has a wealth of knowledge and experience in analyzing this critical data for today's practice to thrive. Cass?
Thank you, Celeste. Thanks, everyone, for taking time out of your schedule to kind of go through the portal. We're going to do a slide deck first, to just giving you a highlight of the changes that we see. We're going to go through a sample packet that we that you would have got yesterday if you are a registered user within the portal. And then I've got one other handout, which is an Excel-based. So let's go ahead through the slide deck. As you know, the proposed rule comes out in July of every year. It came out on the 14th of July. We have until September 14th to put any public comments in regarding the proposed rule. And as Celeste mentioned, we've taken that the proposed rule files that give us the conversion factor, GPCs, and RVUs, and have applied it to some public use data that is specific to your practice and simulated it for you. So just to start, you probably all are very, very familiar with this, but how does Medicare calculate reimbursement? And this is for the physician fee schedule. It's not on drugs or labs or DME. But you have the three RVU components: the work, malpractice, and practice expense. Each one of those gets multiplied by the geographic practice cost index, which is adjusting for where you are in the country, and then they multiply it by the conversion factor. On the practice expense portion, that is could be different based on the site of service, if you do it in the office versus your facility. So that's the formula. And now we're going to talk about the conversion factor. So the conversion factor is going down if you're a non-qualifying APM practice. You're going to see a 1.68% reduction. If you're part of a qualifying APM, you'll see a slightly smaller 1.19. Now, when you look at the regulations as far as what happens to the conversion factor, well, there is a 0.75% increase for qualifying participating practices or practitioners, and a 0.25%, and then budget neutrality would also bring it up. But the reason why you're seeing a net difference negative is because the temporary 2.5% increase that Trump gave through his One Big Beautiful Act is going away. So Right now, the conversion factor is going to be dropping. The other thing that they always threatened, and they've threatened for since 2004, excuse me, is the floor for the work gypsy. So remember, I told you that the gypsies adjust for where you are in the country. The specific adjuster for the work portion, which is the provider's time to do the work, has had a floor, meaning no area of the country could go below 1. Right now, they're saying the floor will be removed and they'll apply the reductions to the work gypsy. About half of the area of the country are going to see a decrease. If your location is on the right side, you can see what that means to your practice. Hopefully, since they've passed legislation at the last minute of 2020 of each year, they'll continue to put in the floor. But we have simulated for you if the floor does not stay intact. Another one of the rules that, or the changes in the proposed rule on G2211, which a lot of urology practices bill for, is they want to change it from being a billable code to being a modifier. And they haven't given us yet what those modifiers are. And there's 2 different modifiers. One is if you're a part of a shared savings program or LEAD, most likely you're not. So if they follow through with the modifiers, you'll probably be getting a 16% increase to the E&M code. So you wouldn't bill a G2211, you just slap that additional modifier on. And I put in the grid the current proposed rate for non-facility E&M. And then I showed you if the modifier G22 was billable, how much the total amount would be when you added. So we'll just take the 99201. $74.88 is what the 27 fee schedule says. You add on the modifier, which would get you $91.98. But if you were to change it to be based on the percentage of 16%, it would net to $86.86. So you can see there are some codes, E&M codes, where the percentage is actually more favorable than just the G2211 bill by itself, which right now they're proposing $17.08. The next item that I'm going to talk about is modifier 25. I'm sure most of you heard this is being proposed. They actually have talked about this in prior years as well. A lot of commercial plans have also been threatening to reduce payments when the modifier 25 is present. So the scenario is you've got the patient in an office facility and you're doing a procedure that holds a 0, 10, or 90-day global period. If you also bill an E&M and you put the modifier 25 on, they're proposing to reduce the lower valued service, whether it's the E&M or the procedure, by 50%. In this example, I took the Cisco, the 52,000, took the amount that it would be paid at using the national average 2027, which would be $203.94. And then I just bumped it up next to each one of the E&Ms that you would most likely be billing. Either it's a new patient or it's an established patient. And then I gave you what the reduction would look like if the lower value code was paid at 50%. In the handouts that I'm giving you or that will be circulated, there's an Excel file that I gave you that has all of the combinations for the top CPT codes that are procedural done in an office by urologists. I cannot simulate that in the portal using the public use data because that public use data does not allow me to look at code combinations. It has no ability to say this code was billed with this code for a given patient. So the best we could do is just give you a spreadsheet to be able, so you could go through and look at code combinations and which one would pay at the lower rate. Now we're going to talk about what we do have in the portal. So we have taken your providers. And how did we identify your providers? Well, we went through the doctors and clinician file to try to build out the roster of all the MPIs that are in your practice. And then we went and we grabbed all of the 2024 utilization claims data. Every year, Medicare releases a file, and it's always 2 years old. 24 is the most recent that we have. But it has by NPI, by CPT code, how many times that provider billed the CPT in an office and in a facility setting. So we have volume statistics. If by chance you have a provider who had less than 10 beneficiaries for a given CPT code, they suppress it. So it is a pretty good database from a standpoint of, volume of Medicare data, as long as you've done at least 10 services for a given CPT code. And like I said, it's broken down by site of service, but we don't have any modifiers. That's not present in that data file. And we take the information, we simulate what would the reimbursement have looked like if you were pricing it at the 2026 fee schedule and then the 2027 fee schedule. Everything has been adjusted based on where you are in the country, and we've used the primary zip code for your practice to drive what gypsy we hit. We realize some of the practices have multiple locations that might hit different gypsies, but we're not able to differentiate where the service was performed. So at this point, we're using your primary zip code of your main office. The provider rosters, I mentioned to you already that we use the doctor and clinicians file. This is a file that gets updated and published monthly by Medicare. If you are enrolled in Medicare, they have a file that we can connect all of the providers who work for particular organizations. And we matched up from the names of the practices that are part of LUGPA to build out these rosters. And it's all at the MPI level. You will see a variety of providers, your mid-levels, if you happen to have therapists. And I will say, if you are part of a larger multi-specialty group, you may see some specialists in other areas other than urology, and we will allow you to go through and clean out if you don't want to see them. But we defaulted to having everybody in the organization loaded with the ability to purge if you don't want to see those. And if you have a provider who has been added recently and it wasn't in your doctors and clinician file that we looked up against, you can always add NPIs as well. So to access the portal, you can go there 2 different ways. You can go through lugpa.org, and you can see the URL of where you're going to find the path to hit that our portal. And then this is the actual login. So you can go directly to the portal, or you can go there through the LUGPA. The first time you go to the portal, you're going to have to ask for a password reset. So your login is your email address. It's not a login you might have to the LUGPA portal. This is a separate, distinct environment. We set up at least 1 user for each of the LUGPA practices. Some of practices had 2 or 3. If your practice wants to have another login, another user have access, you'll want to put that request in through info@lugpa.org. And they'll route a request over to my team, and we'll set up a user. So the first time you log in, just put in your email address, hit the reset your password, and then you'll get an email link to reset your password. Check your spam and your junk in case it went there. If for some reason you still don't see it, you hit the forgot your password, you can send a note to support at Willow Run Analytics. That is in the end of this slide deck. So this is the landing page, and you can see there's a couple of different areas of reports. I'll go in more in the detail of what each area holds when we go into the portal. The impact reports. So all of the reports that you can see, well, how does the changes to the conversion factor or the gypsies impact my group? Well, again, only CPTs that are paid under the physician fee schedule are going to appear. If it's lab, DME, drugs, we don't include those. It's just simulating the physician fee schedule, which are the RVU services. We are not crosswalking any codes. So if a code existed one year and they've got a replacement code this year, it just takes the CPT. That doesn't try to translate to a different code. There are no adjustments for modifiers, APPs, or any adjustments for like the reduction you might get or the increase because of your quality score and sequestration. So think of it this way. We take a code and we look up the fee schedule for your gypsy, and that's what we assign. So if you're looking at a code and you say, hey, my APP, well, they get 85%, or maybe they acted as an assist, those things you're going to want to factor in if you're going to do your own analysis. So we have not done anything to adjust for the APPs. Another example would be multiple procedure reduction. Again, we don't have modifiers to figure out what codes get reduced because they were done with this, at the same time as a higher ranking code. We do simulate 4 fee schedules. So why do we have 4 fee schedules? Well, you think about it, you could be a QPP or a qualifying in an advanced APM or not. And then you could have the 4, right? So there's 4 simulated fee schedules, and we'll see that when we go into the portal. Yesterday, we sent a packet to every registered user that has just a high-level summary report of what does it look like by practice, by provider, and then by CPT code. If you didn't get that packet, either you aren't a user that's been set up, or it might have gone to your spam folder. If you say, hey, I should have gotten a packet and I didn't get a packet, maybe your organization spam filters stopped it from going through, you can send a note to support at Willow Run and we'll mail you that package. It has no PHI. It just has provider and CPT level information. And by the way, the email came from do-not-reply@lugpa.com, so it should have come through, hopefully, but we don't know what spam filters are doing. A few tips about use of the product before we go in. Some of the things that we could suggest to you if you wanted to do is you could go in and look at any of the CPTs where 2027 will show an increase, and you want to set your fee schedule standardly to be 250% of Medicare. Well, you'll be able to see what the current rate is and maybe bump that up to your charge master to see if you have any codes you want to update. You can look at changes to a provider because of the work RVU updates. I'll tell you that I didn't see a lot of work RVU changes in urology. Some of the other specialties, we saw some significant changes in work RVU values. But if you have any providers who have compensation based on work RVUs, you can certainly go through and see the changes that are being proposed. Will it have a net change on the work production? Now, you may say, well, gee, this is old data. It's 2024. I want to see more current data. Or I've got all these Medicare Advantage plans, and I want to see what's going to happen based on volume of what I do for these plans. You can submit your own practices data. It's going to be summarized, and we will give you a template, but you can provide us the data from your practice, and we will load it into the portal for you. So if you're wanting to see data from your own volume, maybe other payers or more current data, you can submit that data and ask for that template through the support at Willow Run Analytics. It takes us a couple of days for us to process that data, but we're happy to do that as a benefit to you, being a part of this tool that LUGPA has offered. The other thing is when you're on a page, there is a little share button. So if you're going to ask a question to support, like, hey, I don't understand this, or can you please, help me understand what this is showing me, there's a share button at the top, and if you do that, it's going to tell us the exact page you're on. So when you send an email to support, and you can tell us what page you're on, that would be great. So before I go into the other documents, I'll stop and see, Kathy, if there are any questions.
No questions in the Q&A.
Okay, great. All right, I'm going to pop over. This is a blinded, so for the purpose of our demonstration, we've kind of taken random providers and blinded their data so that we can show you the report. This happens to be one of the report packets that we sent out yesterday with this blinded set of data. So you have a cover note from Celeste, and then you have the first report tells you how many providers did we identify in building out the roster. So this practice has 37 providers. They've got a radiologist, nurse practitioners, pathologists, 14 urologists. Go to the next page, and this then will break down who did we build the roster off of, and you'll be able to see the breakdown of the physician, who they are, and their specialty. If this list, now if I go to my next page is the actual roster where we're pulling out that 24 data where we've simulated the impact. If you say, hey, I have this nurse practitioner that's on my roster, they're on that previous page, but I don't see them on this report, it's because they didn't have enough volume in the 2024 experience to have anything reported. Or, maybe they're new providers and they weren't even out there in 2024. So just keep in mind that this specific report takes the 24 data for those people on your rosters and simulates the impact. Notice at the top it says non-QPP with floor. So when we ran the report, we decided, well, we're going to assume that people have that lower conversion factor. They're not a part of advanced APM. And we went ahead and said, let's keep in the floor because we're optimistic. We think the floor is going to stay intact. If you want to look at it without the floor, all of these reports are going to be able to run from the portal. And then the last report had the CPT codes and then the overall impact. All right, I'm going to leave that last question to see if anyone had questions on that, Kathy.
No, it doesn't look like there's any open questions.
Okay, so that was the report packet. Hopefully you got it in your inbox. If you happen to be on this webinar and you didn't get it, you might want to check with probably most likely your CEO or your lead physician because we were given a list of key contacts with within each practice to receive the packet. You could also email, I guess it would be info@lugpa.org just to get identify who in your practice is set up and would have got the reports. Before I go in the portal, I'm going to show one more thing, and that is the Excel file that does the G2211 and the modifier 25. We can't simulate it in the portal, but we could give you the spreadsheet that you could use. First one, very busy spreadsheet, right? But it's got all the combinations. So what I did is I took all of the most common CPT codes that the practices are billing in an office setting that carry a global period. In fact, just to make this a little bit less strain on your eye, I am going to take the 52 cysto. Okay. So this is the, oh, you know what? Now I'm missing my, can't do that because it's going to hide that. Here, we'll just do this. There, I needed my other column. Okay, so this is the national average for the cysto. And then I gave you all of the amounts for the E&M codes and how much they would be worth. And then this is the reduction, right? So we figure out which is the lower of the two and then calculate the reduction. And then that will tell you the percent reduction with the code combination. So for example, if I wanted to know the cysto bill with a 99205, I would expect a 23.7% decrease in revenue and that's because I'm going to get $101 less. So this to me is something that's worthy of you assessing and maybe even putting a comment letter to the government, because that's a significant reduction, in my opinion, is having the lesser of the E&M or the procedure being reduced. Kathy, any questions on that? Okay.
No.
All right. And then the last one is just that G2211. This is the data that was in the slide. If you wanted to take it out and do some math on it to load in, the percentages of time you're billing the G2211 with the E&M code, and then figure out what the dollar impact would be. All right. I am done with all of my slides and the handouts. Now I am going to go to the portal. So you hit the portal directly through the link, or you get there through the LUGPA area that brings you into the fee schedule. And I'm going to log in as my demo user. I've already reset my password, and I log in. So very important is just to accept the terms of using the portal. So please do click the terms, review those. You can go back and then accept. Once you accept those terms, you're in the portal. Aren't too many options. We tried to keep it fairly clean for you. But if you do have questions or support, you can just click here and it'll bring up the hyperlink to create an email. Just a reminder about the share, which is up here. It'll actually tell you the page that you're on. Okay. I'm going to hit back up top. Now, anytime you want to go to a different area, I'm going to hit back home so I can get my main menu again. I'm going to highlight the provider roster first. You have it in your packet, but if you wanted to see visually all of the providers, if you click the roster, you can add a provider to the roster, and you can also deactivate. I would say if you want to modify your roster and you have like a bulk list, right? We could do it behind the scenes for you, or if it's just a quick 1 or 2 add, or you want to deactivate, you can use this page of the portal to do it. Okay. All right. Now, the practice supplied, this analysis using practice supplied, it's going to have nothing unless you provide that data. So if you go into the report, you're just going to see a big blank window because that requires you to supply the data. I'm not going to cover this in today's tutorial. If you decide to provide practice supplied and you provide us the data, we will meet with you one-on-one to go through this area of the portal. Okay? That leaves 2 areas. So the first one is the Medicare Physician Fee Schedule, which is just giving you access to look at the Medicare rates over time, and it's not specific to your practice. It's just kind of like, I want to know what's happened in reimbursement of cystos over time, or the change in the RVUs. This area of the portal is generic, not specific to your practice. The data that's specific to your practice is this analysis using the public use files. I'm going to go through the Medicare Physician Fee Schedule area first. Once I go into that area of the portal, you'll notice that I have 3 options. I have the fee schedule, I have a graph, and then I have this pick a measure select. I can get it to it up there, or I can just click these on the bottom. So I'm going to go to the fee schedule first. And by the way, all of these reports you can pull out to Excel down at the bottom here. Okay. So let's talk about filters first. Filters determine what makes it in the report. And you can see that my initial, when I initially go into this page, I can pick the pricing logic. So here I've got those 4 that I mentioned to you. Do you want the floor applied or not? What QPP, what conversion factor do we use? So right now I'm using non-QPP with floor. And then on my year, well, we have given you the ability to go all the way back to 2015 if you want to see what's happened in to the rates or the conversion factor or the gypsies. We show you all the way back to 2015. And then there's all of the areas of the country. Now I'm defaulting to national. And then locality. Now, in locality, say I'm in Illinois. Well, I've got like 4 different localities in Illinois. So the locality you could pick, you could be very specific and say, yeah, I just want to see the greater Chicago, right? CPT class, familiar to you, I'm sure. This is just a way to group together codes that are similar. So you want to look at E&Ms, you want to look at surgery, you want to look at medicine codes. And then you get down to the actual CPT code, okay? And you can pick multiple if you want. You can click as many as you want. So let's look at this page first. So I've got all 2027 data, and I'm looking at the national rates, and I'm looking at it for all of the E&M CPT codes. How might I use this differently? Well, let's say that I happen to be in Alabama, and actually I want to take out national. So I want Alabama, and I want to look at just 99214, for example, and I want to look at all years. So I can come in and say, unclick that, I've got all my years, and now I can see what's happened to conversion factors, the rates, and we're giving you the facility and non-facility rate, and then all of the breakdown of the RVUs and the gypsies. So that formula that was on one of the initial slides in my deck, okay, how do you calculate? Well, you got to do the gypsies, you got to do RVUs, you got to do the conversion factor. That's all here for you. Another thing I can do is, let's say that I wanted to look just at 2027, and I wanted to look at all of the rates. Like, how would it be different if I was a qualifying APM? Or what if the floor did not get reinstated? Now I'm looking at the rates based on the different variables. Okay, so you can imagine underneath this is this massive cube that has all of the localities, all the years, and the breakdown of whether or not you have the floor applied or not. So this is obviously a tabular view, lots of data. Pull it out to Excel if you want. But let's say you just wanted to see a visual presentation of this information. So we're going to move to the trend graphs. And for this, we'll stay with my office visit. So I'm looking at non-QPP with floor national average. So I've got what's happening to the work RVU, the malpractice, and then because the practice expense gets broken between facility and non-facility, we give you a trend line of what's happening for both of those depending on where you do it. And then we have the total when you add all 3 components up, the conversion factor, and here's your fee, right? So if you hover over it, I can see that the national average for a non-facility is 132.68, okay? And then down below are your gypsies, and because I'm on a national, well, remember national is always 1. If I wanted to look at, we'll go back to maybe Alabama, then you can see what's happened to the gypsies, all right? Now I'm on a page that maybe I want to print out and put into like a PDF. You can always hit the print button up here and it prints to a PDF and it'll bring the page out. So that's another way. In addition to Excel, you could also do a print to a PDF. I won't open it up, but it brings up into a PDF. The last option we have on the physician fee schedule is we built this pick a measure, okay? So you can say, what do you want to see? It's defaulting to a non-facility fee. That's what's in the body of this. And it's meant to show you a trend over the last, 12 years to say what's happened to the RVU components, the gypsies, the conversion factor, the fees. So you can pick the measure that you want to look at, and then it will go across and you can see, okay, I can see my office visits back 12 years ago at 209 and now it's 226. right? Well, maybe I want to go in and I want to look at surgery instead, and maybe I want to look at cystos. And by the way, when you're in a filter, you can actually search. I can say, well, I want to see the 52,000. You can just search it and then it will pop it up. All right. So again, we can change it if we want to know, let's say, the work RVU. Okay. So those are different ways that you can go in and look at the fees since 2015, and basically any code. You're not restricted to just the codes that you see. If you're interested in looking at a code that you're starting to think about billing for, you've got the fees in here. And that's it for my section on the Medicare rates, just the generic look up a code. Any questions?
No written questions.
Okay, great. Now we're going to get in the fun part, which is where we take these fees and we apply it to your data. So I'm going to go in and run this area. Again, we try to make the reports not the like 10,000 you can go to, but you'll find that any given report, you can customize that report to get it to the way you want, because you have the filters that you can apply, and you also can change the report itself. So I'm going to walk through an example. For this practice, right now it's defaulting to non-QPP with the floor, and it's doing it by specialty, okay? And it's telling you how many services did the 24 utilization data have, and this is just a percent of the services. Then the value, if we price it at the 26 rates, and the value at the 27 rates, and then the difference column. So this practice across the board is going to see a 2.06% reduction. And I can see the variation between the different specialties. If I wanted to look at this a different way, like maybe I just wanted to look at it by the CPT code, right? I could go in and I could look at it by the CPT code itself. It's sortable. So I want to look at the largest difference. So I can see my office visit is going from a dollar perspective, it's going to see the most reduction. If I want to see it based on the percent difference, I see that my pelvic exam is going down. If I wanted to use filters, like let's say that I really only want to see the impact for my urologists, I can apply my filter to say, just give me my urologist, because I want to know the biggest difference. So I can see there's the 99214, and then I've got my cystos. You can dive further. Let's say on my cystos, I want to look at it by site of service, because maybe I want to know, oh, this is good for me to let my docs know that if I do it in my ASC, I actually will get, my reduction is only 1.92%. The office reduction is 4.92%. Okay. Now, maybe you want to see the RVUs, like you just want to get down to the nitty gritty, because this is just showing you the total dollar amount applied, the rates times your volume, and you wanted to be able to look at the actual CPT breakdown of the changes. You could go back to that other area and pick it up, right? The 52,000, and you want to look at the changes over time, but we want to apply this based on your volume. So you can do the RVU detail report, and let's just go in and take our 52,000. And so now this is giving you 4,000 services. It breaks down all of the different RVUs. And then here's your fee. And that's at 4.42%. Now that average is blending it, because right now I'm at a level that's saying all the times you bill the 5,200, and we know there are different rates if it's in the office or in the facility. So we can change that to say site of service, and then I've got the breakdown. Okay, and then I've got my RVs to the right. Any questions so far, Kathy?
No questions.
Okay. Just keep in mind that the filters matter, what you're looking for. I'll come back to this one level for a minute. I'm just going to hit reset. I want to go back to where I was originally. I'm going to switch this back to my provider specialty, for example. Okay. Now, if I didn't put a filter here with the non-QPP with the floor, and I said, give me all of my different pricing scenarios, if I unclick that, and now I'm going to flip this to the pricing logic, if you're in an area of the country that the work floor is different, right? Like the work floor would go below 1, this would be a report I recommend you run, because it takes all 158,000 and it runs it for all 3 scenarios. Now you need to be careful not to use that total line because it's just adding up all of them. But we can see that with the QPP without the floor, they're going to get a 2.85% reduction, because this happens to be North Carolina, and they are subject to the lower work gypsy. If the gypsy holds, it's 341,000 or a 2.37% decrease. Okay. So the 2-level, it's the same type of report. We just give you 2 columns that you can flip, right? If you wanted to see, you don't want to see it by provider, but you wanted to see it by CPT class, then it summarizes the volume and shows the impact based on the type of service. So the last thing I'm going to show you is what we call our ad hoc, which I personally love. It's a feature that we have been able to implement that makes it easier for, say, a person that likes to do lots of pivot tables in Excel, but we don't want you to take it out of Excel. We want you to be able to use the portal to navigate the data on the fly. And I'm going to go to the ad hoc. And this is the last area I'm going to cover today. And in the ad hoc, you can build additional filters. You can cross-tab. You can add more dimensions. And I'm going to walk you through that. Okay, so we start with kind of like a basic view that we think maybe you want to just start with volume of services and the dollars between 26 and 27% difference. And we're breaking it down by CPT with description. So you've seen me on other reports take this and change it. So I'm going to change it, and I'm just going to say specialty. Okay, so now I just grabbed what are all my specialties. I can see how many providers there are and the number of services. And let's say that I only want to see my urologists. Well, I can take this and dive, but I could build a filter. So this 3 dot at the top, that allows you to add a quick view. So I'm going to add specialty as a quick view. So now I can say, yeah, just give me my urologist, and it gets rid of everybody else. And you say, well, wait a minute. Maybe I want to look at all physicians, not just urologists. Fine. Let's go in and add a quick view, and we'll say provider class. Okay. And I can take out that urologist, and I can say physicians. Okay, so now I have all my physicians in my report. So I've got my physicians, and maybe I just want to look at my urologists. We'll just do urologists. Okay. And I am now going to add a dimension, meaning I want to keep my urologist, but I want to look at it by my provider. So I'm going to add my provider, and there's all 14 of my providers. Well, heck, I pulled my urologist, so maybe I don't want this first column. It's just cluttering. I'm going to remove it. So I've got all my docs, and now I want to just do a summary based on what's going to happen to the evaluation management, surgical codes, etc. I can add a dimension. I can say, give it to me by my CPT class. So now I have all of my providers by the CPT class. Another thing I can do, I can pull this out to Excel, right? But maybe I want subtotals. So I can come up and say, show subtotals. And now I've got a really nice report that has the overall by the doctor and then the subtotal. Okay. Now let's say I like this report and I want to bookmark it because maybe I want to come back later, but I would want to remember exactly this report that I did. So I just come up to my, you can either do Control B like you do for other applications for bookmark, or I can just say add it. And I'm going to call this my urologist only by CPT class. Okay. And then maybe I want to change this dimension to be CPT code. And I want to maybe now bookmark this one and I want to call it urologist okay. Now I have them in my bookmarks. So when I come back to my main navigation, I can run it. I can go back and say, yep, run me that report. And it remembers the exact report that you did. Okay. So lots of functionality in this. The other thing I wanted to show you with the ad hoc, I'm going to remove this dimension. I'm back to my summary. And maybe I want to do a pivot, right? You might say, oh, I can pull this out to Excel and I can pivot that. Well, don't take it out to Excel. You can do it right here. Let's say the dollar difference, we wanted to add a cross dimension and we want to look at it based on the CPT class. Now I have the dollars broken down into what is the CPT code. And to get rid of it, I just say remove cross dimension. Okay. Lots to do in the ad hoc. They're fun. You can build reports. We do have additional fields. Like I could click this and say, expand the work RVUs. Maybe I just want to see what's happening with the work RVUs. I can remove that. Or I can come to the three dots and say, I'm really interested to see where the malpractice or my practice expenses changed. You can say add a column and then you could add any field to the report. So you wanted to see your, maybe the total RVUs, okay? So we've exposed a lot of the fields that make up the fees. We have the per fee amount, we have the total amount, and rather than give you 20 reports that have all those different versions, you can use the ad hoc to build your own. We're here in support to help you. If you get into the ad hoc and you just need some help, just email support and we'll get on the web with you. And that is it. Happy to do any what ifs. And keep in mind, it is the 2024 data. So we're limited to what we can show you. We'd love to be able to show you your all payer, but you know, you would need to do the practice supply data for us to do that. Back to you, Celeste.
Thanks. Well, thanks everybody for attending today. There will be a recording of the webinar available to everyone for your review, going back to questions that you might have in this quick coverage of this fantastic tool. We will have that available and out to you via email shortly. Again, if you want to add any additional people to have access to the portal, you can send those emails to info@lugpa.org. So thanks for attending and we appreciate your attention.
Thank you.